my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Alexis Sanderson. She is 12 years old, holy smokes, and her grandmother, her name is Sonia. And on the last video, we did an activity to get range in the latissimus dorsi so that she could reach up overhead. We did this before and she was unable to do that. So now, Alexis, you need to reach with both arms and then you're going to get kisses from the doll. Are you ready? This arm needs to reach up. Alexis, both arms need to reach up. Both arms. One, this one too. This one too, Alexis. Alexis, this arm too. That's it. Wonderful. Get some kisses. Oh, goodness. You ready? Let's do two more, Alexis. Reach up with both arms. You want the other one? Get this one more time and then we'll get her, okay? This one more time. Oh my gosh, you ready? Both arms have to come up. Both arms. Are you ready? This, reach up and get him. Put it right here where she can reach it.
The doll.
And this one too. There you go. Woo-hoo! So what's this working is that thoracic extension and the range in her arms, obviously. This arm too, and then you get your kisses. There you go, Alexis. Go ahead and give her kisses. Oh, such good kisses. This thoracic extension is really important because kids tend to get rounder and rounder in their trunk, especially as they get older, which puts them more at risk for scoliosis. This is a fantastic activity to work on this with Alexis. Again, with her, we really had to get the range of motion in her shoulder first. Hope this is helpful, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. Did you get the kisses? If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.